Hi, and welcome back to Medicare and More. My name is Kerry Faria, and I'm the Assistant Regional Director for the Central Massachusetts SHINE program. So welcome back. And today what we're going to talk about is a little bit about Prescription Advantage. I have a guest speaker with me. Her name is Devine. And Kathy, can you tell everybody a little bit about what your role is at Prescription Advantage?
Certainly. I do work for the Executive Office of Elder Affairs, which is the state agency that administers the Prescription Advantage program. So my role in particular is I'm the outreach coordinator. So I go around the state, I talk to seniors, I talk to professionals, people who work with seniors. I work very closely with the SHINE program to make sure that SHINE is up to date on everything that's going on with Prescription Advantage, because it is a great program. It really does help to save people a lot of money, so we want to make sure we're getting the word out about it.
That's very true. Yeah. Very true. So speaking about saving some money, what we'd like to talk about today are just a few points that are very specific to Prescription Advantage. So now we're outside of the annual open enrollment period, the open enrollment period. So now we're kind of in this period where, let's say, for some reason something came up in your life. Maybe a family member got really sick, or you were very, very busy, or again, stuff just happens. And wow, now you're not during that open enrollment period, but you didn't change your drug plan, or you didn't change your Medicare Advantage plan. And it doesn't look like it's going to be very good for you for 2016. What do I do? So Kathy, can you explain to everybody kind of a nice feature of Prescription Advantage that can really help people out during this time?
Prescription Advantage, where it is a state-sponsored program, it's what we refer to as a pharmacy assistance program. So first of all, it doesn't replace what you currently have. It doesn't replace your Medicare Part D, or it doesn't replace your Medicare Advantage plan. It does act as a supplement. One of the benefits, though, of being a Prescription Advantage member is that you do have one additional time a year, a time that's outside of Medicare's open enrollment, that you can change your Part D plan or change your Medicare Advantage plan. When you're going through Medicare's open enrollment period, it is that small window of time, and you're making your decisions on your plans based on that day. What are the medications that you're taking that day? And we know things change. So somebody's, they do change their plan, and they say this one's going to be perfect for me for next year, and then they may be prescribed a new medication, and they find out that medication isn't being covered by their plan. And I know as SHINE counselors, the first thing a SHINE counselor will ask somebody is, do you have Prescription Advantage? Because if you do, if you qualify for the program, you will have that opportunity that you can now make a change so that you can find a plan that's going to work better for you for the remainder of the year.
So, and just for everybody to know, what that's called is a special enrollment period. So that allows a person with Prescription Advantage one time. They have a special enrollment period.
That's right.
That's one time during the year, the calendar year, outside of the normal open enrollment period. Because life happens, stuff happens. And a perfect example you just gave is you could have researched your drug plan, you could have researched your Medicare Advantage plan to the best of your ability, did all your homework, and like you said, you go to the doctor's office and wow, now you're on a medication that maybe isn't on your formulary, or maybe it's super expensive. What are you going to do? So that's a perfect example of why it's important to have Prescription Advantage.
And I think what we find too is a lot of people, they're comfortable with their plan because it worked. They didn't have any problems with it, and they thought, and they'll say, why bother going through all that work of comparing plans? This is fine. And then January rolls along and they're caught off guard. They're totally caught by surprise that, this plan that worked great one year, now maybe they increased their premiums, maybe their co-pays have changed. One of the things, I know that you've seen this a lot too, is they changed their formularies. And not even so much the removing of medications, but changing the tier that a particular drug is on. So in doing that, if it goes onto a higher tier, you're going to pay a higher copayment. So maybe that plan just isn't the right plan for you.
That's very true. And another thing to keep in mind is that the Medicare Advantage plans and the Medicare prescription drug plans, unfortunately or fortunately, whichever may be, they can change mid-year. They can change what drugs they cover. They can drop a medication off their formulary. They're, I think, encouraged to stay with their formulary throughout the year, but changes happen. So again, don't worry though, we have Prescription Advantage to the rescue.
Right.
So, and for the majority of people, it's free. It's a free state program. And we'll talk a little bit more for other people it won't affect. But so what about some general program information, Kathy? What can you tell us
It's
about?
not all about getting you out of a plan that doesn't work.
That's right.
We certainly have a lot more benefits, and Prescription Advantage is there, as I said, to supplement what you currently have. And particularly for people who may reach that coverage gap that I think if I said the term donut hole, a lot of people would be familiar with that term. And as you know, that donut hole in the Medicare prescription drug plans, it's a gap. And people will reach this gap depending, it depends on how the cost of their medications, but if they reach the gap, that's when their out-of-pocket expenses go up. And I believe, and you can correct me, if somebody has a brand name drug and they reach that coverage gap, they would be responsible for 45% of the cost of the drug.
That is correct.
Yeah. And for a generic, it's 62%, somewhere around there. It's pretty,
58, something like that.
It's up there.
Yeah.
But just think if you had a prescription that was a $300 brand name prescription. Oftentimes I talk with a lot of seniors who will say, well, I have this inhaler. Well, inhalers, sometimes even on the low end, are around $300. So can you imagine if you all of a sudden are being charged 45% of that cost?
Yep.
Okay, so that's when people do reach that coverage gap, and that is where Prescription Advantage can help. So as a state-sponsored program, it does have income limits. Okay, so we actually have two eligibility requirements. One is that you're a resident of Massachusetts, and the second is that you do meet our eligibility limits. So for people to have coverage in the donut hole for a single person, as long as their income does not exceed, refer to my chart here, $35,310. Okay, so that's for a single person. For a married couple, their combined gross annual income, as long as it does not exceed $47,790, they'd be eligible for Prescription Advantage. They would have coverage in the donut hole, and it's free.
Did they look at assets, Kathy?
No, that's very unusual for a state or even a federal program.
Extremely.
Typically, they'll look at both income and assets. This is unusual, but we like it. We don't look at assets, it's just gross annual income. So think of Social Security, pensions. Somebody may be taking money from an IRA or a 401k plan. Okay, that is what we would be looking at. That's what we count. And depending on what a person's income is, that'll determine what membership category they would be in. And then that membership category is going to indicate what a person's copays will be. So just as an example, let's say we have that person that has the $300 inhaler, only to find out halfway through the year that instead of paying whatever they paid for copay before, maybe it was $30 or $40, now they're going to pay somewhere around $145. And that is when Prescription Advantage can help them. And it's very easy. the pharmacy, when somebody's getting a prescription filled, the pharmacy bills their Medicare plan. The Medicare plan tells the pharmacy what to charge the person as a copayment. And then whatever that copayment is, before the member opens up their wallet and takes the money out, the pharmacy's going to bill that copayment to Prescription Advantage. And then we will tell the pharmacy what to charge the person. So for a brand name drug, instead of paying $145, we may say, charge the customer $30 or charge the customer $18.
So, and just as a side point that I was thinking of, so that works for Medicare prescription drug plans, and it works for Medicare Advantage plans as well with drugs. So what if somebody has a retiree plan, a private retiree plan? Does Prescription Advantage also work with that?
We will, and we'll work the same way. You know, what we're doing is, it's just once the total cost of their retail drugs reaches a particular amount, okay, which would be, you know, if somebody has Medicare, it would be at the point that they reach that coverage gap. But for somebody who has a retiree plan, they don't have a coverage gap, but we'll use the same threshold. You know, once the total cost reaches that amount, okay, if their Prescription Advantage copays are lower, then they'll pay the lower amount.
So that's very good for everybody to remember, which is, again, if a person does have a private retiree plan, you can use Prescription Advantage as well. Wow, that's excellent to know, because it's not just dependent on Medicare.
That's
you can
right.
use it with your retiree plan.
Exactly.
And again, that's really rare. There are not many programs that work with your retiree program as well.
You know, and
so what an
retiree programs, they have several tiers. You know, they're set up so that they have multiple tiers on their formulary. People can have very expensive drugs and pay very high copays. And it's a relief to know at a certain point in the year they could find with Prescription Advantage that they're going to pay a lot less.
That's excellent to know. And just really briefly, what about individuals that are disabled? Is there any sort of special requirements for them?
Well, if somebody is under the age of 65, we do have a different income threshold for people, and that would be their income for a single person would not exceed $22,128, and for a married couple it's $29,948. So if they're under 65, the income limit is different. Once they turn 65, then it would increase.
Significantly, it
Yeah.
sounds like. Okay. So, with that said, let's talk about the highest income category a
Right,
little bit.
because, you know, the numbers that I gave you, and I said, well, if your income does not exceed, as I said for an individual, a single person, if it does not exceed $35,310, yes, you'd have coverage in the donut hole, it's free. But we do have an income range that goes beyond that. So if someone's income exceeded that amount, that $35,000, and it was in between that and $58,000, and it's $58,850. And for a married couple, if their income was between $47,790 and $79,650. Okay, so it's a higher income range for both individual and married couple. Benefits are different. Okay, first of all, Prescription Advantage will charge. It's a monthly, it's an annual enrollment fee of $200. And then benefits will not begin until the member has spent out of pocket $3,530. Okay? And that's in copays. So it doesn't count the $200, it's just in copays. So just think somebody in January with their very first prescription that they're getting filled, they pay their copay, that's when we start adding it up. And if some point during the year they reach that $3,530, okay, that's when they will no longer pay any more copays. It puts a cap. So really, it's intended for people who have very high drug costs. And I know you've seen them too.
Oh,
I mean,
yes.
it's, we've seen people that have drugs that $5,000, $6,000, $7,000, of which their copay could be 30% of the cost.
Yep.
So there are a lot of people who could easily spend that $3,500 very quickly.
Yes.
And at that point, we would say, again, put your wallet away. From now until the remainder of the year, you won't have any more copayments. Prescription Advantage will cover all of the copays. So I've had people say to me, that's all I have to spend. Last year I spent $11,000 or $12,000 out of pocket, not realizing that there was a program that could have helped them with that.
Exactly. So what is very encouraging, though, that we want to make sure that people are aware, just to reiterate what Kathy was saying, is that when Prescription Advantage starts taking into account to what a person is paying out of pocket for their medications is when they become a member. So and that's during a calendar year.
That's right.
It's not during just within 12 consecutive months. It's a calendar year. So what that means is if you are in the higher income range, your best bet is to become a member of Prescription Advantage somewhere in the early winter. So it'd be like January, February, March, those months, so that the program Prescription Advantage can start tracking how much you're spending out of your pocket immediately in the beginning of the calendar year. So that you can, let's say you hit that $3,500, $3,300, $3,500 threshold. Let's say if you start tracking that information or what you're spending in copays, you start tracking that in January, well, maybe you're going to hit that $3,500 limit in June.
That's right.
But if you wait and you don't become a member for Prescription Advantage until like May, well, then you're not going to get as much of a benefit.
Well, and people have said to us, well, I've spent the $3,500, I think I'll join now. And no, you need to spend it while you're a Prescription Advantage member. So what happens when people come to us towards the end of the year, it might be September, they're going to be in this highest membership category, we need to make sure that they understand, well, first of all, it's a $200 charge, and do you think you're going to spend that $3,500 between now and the end of the year? Because some people, they just won't, they won't get any benefits from it. So that's when, as you said, hold off, join it to become effective January 1st. That way, it's a new plan year. We do work on a calendar year basis, and we will be counting every copay.
And for some people that are higher income, in that higher income bracket, they may not even spend $3,500 in copays on medications. So it may not be worth it for them to be a member spending $200 for that privilege. So again, if you have any questions about whether I'm going to hit the $3,500 limit, you can certainly call Prescription Advantage. You can certainly call us. We will track that, and we'll try to talk with you about that a little bit to see if we think you're going to qualify and it's worth your while. We'll be very upfront about that. So, but still, if you're a little higher income and you have expensive medications, you mentioned inhalers, insulins are very expensive. Some, again, cancer medications, very expensive. So those are all medications that if you're taking, and again, you're a little higher income and you want to see if you qualify, now's the time. We really want to stress that. So early winter really is the time to explore this. I always cringe when I get somebody, it looks like they qualify, but they're coming to me in October. I always say, no, wait, just wait a few months and then apply, because it'd be a perfect fit for them. It just isn't in October. Yeah. So again, early winter, this is the time to make a move. So we really wanted to stress that on this particular show.
I think this is one of the nice things about Prescription Advantage too. Unlike Medicare's open enrollment period, which is a little window of time that you can, make these decisions and make these changes, with Prescription Advantage, you can join Prescription Advantage at any time during the year. And that's, as we're heading towards the end of the year and January's right around the corner, it's something to really be thinking about, because, what are your drug costs, and are you going to reach that coverage gap? you want to make sure that you have Prescription Advantage in place, particularly if you are at that income range where you will have coverage in the coverage gap. You don't want to be in it and then be on the phone to Shine and say, what can I do? Because we can't help you with the money that you just spent. So we want to make sure that we're getting people before they reach the coverage gap, so we're there when they need us.
That's right. That's right. And one other thing I thought would be good to talk about just a little bit about is what if people like to use mail order?
That's right.
So, okay, so a lot of people like it's convenient, and actually it's less expensive. So can Prescription Advantage nicely segue with people that use mail order?
We do. We will be a secondary payer because to us, it's just a pharmacy billing us. So whether it's, the brick and mortar pharmacy or it's I like to think of a virtual pharmacy, it still works the same way. That's the pharmacy that's filling your prescription, and they're the ones who are doing the billing. We will be a secondary payer. The only word of caution that I would give is that not all mail order companies will bill a secondary payer. We don't have that problem with, say, CVS. They know who we are. We're Massachusetts, we're a state program. But, there might be a mail order company that you're using that is located out in Oklahoma and they don't know who Prescription Advantage is, or their systems just may not be set up to do secondary billing. What I would suggest is for people who do like to use mail order, and I can certainly understand why, there are a lot of benefits to using it, that they check with their primary insurance. Check with your Part D plan, check with your Medicare Advantage plan. Who is the mail order company? Do they do secondary billing? You can even call the mail order company, because in getting everything set up, that's something you would be needing to contact them anyway to make sure that they, that you're in their system. But you want to ask, do you do secondary billing? Because if they don't, then the individual would need to get their receipts to Prescription Advantage. So every time they got a prescription filled, they would have some type of a receipt or explanation of benefits to show what it is that they purchased and how much they paid. Those need to get to Prescription Advantage. And our members can just call Prescription Advantage to ask, well, how do you want me to do this? And we actually have a claim form that we'll send them and just say, just fill out the claim form, attach your receipts, and we'll take care of it.
But that's really a nice benefit, because a lot of programs, again, if it isn't already set up to accept that second billing, won't do it. So the fact that a consumer can actually submit their receipts to you to get reimbursed is fantastic.
It is, and that's why I say just don't forget to send them to us. It's just don't let them pile up, because that's something that you need to get them to us within a year. So just as they come, just send them in.
Exactly. So again, kind of the moral to the story is if you think you like mail order, but it doesn't look like the mail order that you have through your particular drug plan or through your Medicare Advantage plan won't process it, or maybe they don't have the capacity to process it.
Right.
You're not out that money. You're not. You spent that money. So save those receipts.
That's right.
Get them into Prescription Advantage and you're going to get reimbursed.
Yeah. So, that's how we're going to know too. It's all through the billing. We know when people reach that coverage gap, or when they have, their total drug costs have reached the amount that, okay, this is now the point where Prescription Advantage is going to start paying. Okay, but we have to have that claim data in our system to be able to do that.
Boy, that's an excellent benefit. So quickly, any other things you think folks out there might want to know about Prescription Advantage? Anything you can think of?
Well, in addition to how do I enroll, we have a couple of different ways. We have if somebody calls Prescription Advantage, and I haven't even mentioned the phone number yet.
We'll get it up.
Yeah, okay. But you can call Prescription Advantage and we can send you a paper claim form, okay? Very simple form. Customer service will even offer to do the application right over the phone with you. And we also have a website that we can provide you with the, with the website name. You can go in yourself, and there's an online application that you can key. In addition to the application, though, because it is a program that is based on income, we are going to ask for proof of income. But again, if you are still filing federal income tax forms, what we would ask for is the first page of your federal income tax form. Okay? That's all we need. And if Social Security is part of your income, then we would also ask for either the 1099 or the annual award letter, which are probably going out now.
Pretty soon.
Yeah, I was going to say the annual award letter, that's the letter that tells you what your Social Security benefit is going to be next year. So tax form and Social Security document, if you no longer file federal income taxes, but you have Social Security as in, then we would need the 1040 or the 1099, too many numbers, or the award letter.
Regardless, it's easy. So
Yes,
that's
right,
the bottom line. It's
right.
easy. And I can vouch for the fact that I've used the online application. It is so smooth. So I've said it before, but boy, if you're using the computer at all, that's really slick. It's a great way to go. But again, you have to remember to submit your financial information after the fact, because just by submitting the application doesn't mean it's ready to be processed.
Exactly. That's the first piece of it.
That is
and
correct.
Doing it over the phone, whatever is the easiest way to to take that first step. But you still need to send us some additional information.
Exactly. Well, I want to thank you, Kathy, for coming today and being a part of the show on Medicare and More. Always wonderful to learn more about Prescription Advantage, and it's such a great program. So thank you very much for coming out today.
Thank you for having me.
We really enjoy that. So before we wrap up, though, I do want to mention one thing that's a very good piece of information for everybody to have, and that is for 2016, the Tufts Medicare Advantage plan is now what is called a 5-star plan. So a 5-star plan means that Tufts did an excellent job. It's something that they deserved. It's a special rating that's given out by the Centers for Medicare and Medicaid Services. And what it means is that during the year, so it doesn't matter what month of the year it is in 2016, somebody can enroll one time into any of the Tufts Medicare Advantage plans. So that's kind of a nice piece of information for our area, or the area in southwestern Worcester County, because Tri-County Medical Associates has Tufts as their exclusive Medicare Advantage plan. So for some reason, if something comes up and you didn't know that, you can use that one-time opportunity to get into the Tufts plan, and then you can have that coverage at Tri-County Medical. So just for everybody to know, Tufts for 2016 is a 5-star plan. So if something goes wrong during the year with your insurance, that is an option of enrolling into. So just want to make sure everybody's aware of that. So again, thank you very much for joining us at Medicare and More, and we look forward to talking to you next time. Thank you.